is outside, you call them, they will listen to an important life story. I am Dr. Wani, born in a village from the aspirational district of the country, that's Kupwara. My basic education from the same village up to matriculation up to TDC Part 2nd. I got 25th position on open merit in J&K Board of School Education 1982. I have got into the medical college Srinagar on open merit when there were 2 medical colleges only. The basic schooling was tough. We didn't have at that time the shoes to wear, the clothes to use. The today's children, they have all the facilities. Think of that era, but the road connectivity was not good. It was primitive. Then we used to go by the bus, by a tonga, on foot, borrowing the books from the others. Anyway, this dream was, when I had thought of becoming a doctor, when I was 7 years old, that means maybe 2nd or 3rd class. Because our father used to tell the stories, how the people become the doctors. Now the IS is there, IPS is there, civil service, other IPS is there, and other technology has increased, other branches are there. But at that time we were not knowing. Our parents were literate, but at least they were knowing that education is important, giving the stories of how to become a doctor. So the dream was the motivation. Their story was the motivation. I did my MD from Sher Kashmir Institute of Medical Science and Medicine. I did my 3 years in gastroenterology from the same institute. I was the only eligible candidate on merit to be the assistant professor of gastroenterology at that time. But you know the circumstances, the bureaucratic effects, the other things made me to leave the country. I left the country and served outside in different countries for 10 years. They recognize merit, they appreciate you, they encourage you. I was trying to leave, they were increasing my salary. Doing MRCP outside, I got the offers from UK, Australia, Canada. But one thing was haunting my mind, that I have become a doctor because of taxpayers' money. I have dreamt to serve my own people. I don't know how many of you are from the rural background and now migrated to the urban areas. That concept, that thing. One day in 2008, I wrote on Facebook page that getting this much experience and expertise and saving the lives across abroad, why not back home? I said, alas. The prayers went up, these were accepted. In 2010, I returned back. I joined a consultant medical college in medicine and emergency medicine. Triage was not a concept. You know we are from the village. I don't know how many of you are from the village. When they come, they reach the tertiary care hospital for the treatment. The transportation is poor. The road connectivity is poor. The most of the people, whether this trauma, this heart attack, this stroke, this is sepsis, they were dying on halfway, either in the vehicle or when they reached the hospital. The innocent people were not knowing how to reach the doctors because of the busy and the overload. Anyway, this stimulated me, this pained me to develop a hospital in my own area, to decentralize the tertiary care. In 2014, I started. In 2016, I became able to construct the building that is by the name of Quality Healthcare Hospital. The quality is not a concept everywhere. You learn the quality outside. You think the business leaders, you think of the brand, but first you think the which quality. You want to buy something, you think of the quality. So the quality in health is very important. It means when you are a patient, for what the patient comes to your hospital or to you, we want a safe outcome. We want excellent results. We want the timely treatment. We want to address his issues. We want to have his best treatment at low cost. So decentralize the tertiary care hospital was the concept to give back to the villagers, to that peripheral area, the same treatment which every citizen of our country or the world has the right. The global WHO slogan is Health for All 2023, Equal Health to All in 2024, and this year, Healthy Beginnings and Future, Hopeful Future. So that means this year's campaign and slogan is taking care of the mother and the baby newborn. When they are healthy, that means the future will be healthy. The future will be hopeful. I got this hospital accredited. It is anyways accredited that the quality stamp, as there is any trademark certification for any other product with which you import or export, all you business leaders. So finally, this is a 50-bed hospital. This is serving the orphan area, the poor, the innocent, the downtrodden, and in addition to our armed forces and paramilitary forces who are guarding our borders and making our country safe. I'll start a brief introduction. How important it is about to develop the peripheral health care in our country. Our country's population is 70:30. That means 70% of the population is rural, 30% is urban. This is rough. So, if we take the health and care infrastructure, only 25% is in the rural, 70% is in the urban. If you see the graphs here, that will depict the clears. We need, what are the things which we are lacking as compared to this, as compared to urban population? All the big corporators have our laborers. If we consider in 1990% of our GDP was because of agriculture. Now it has come to 17%. This rural person, he works in our industries, our cotton textile mills, our labor, in any other class. Mainly, our country is agriculture producing country and horticulture. We need to take care of their health. So this disparity needs resolution. There are excellent schemes. See, we don't have in the rural areas the awareness. Still many people attend those traditional, because of the lack of the allopathic, lack of the proper treatment, lack of the proper equipment, lack of the proper diagnostics, they attend the traditional healers. This makes the diagnosis late and the treatment delayed and the mortality more. If we take up the overall life expectancy in the rural and in the urban population, there is 2 years difference. The lifestyle diseases have equally increased in both, but the screening was less in the rural areas. We need to focus on. There are government policies to promote these, to promote the sanitation, to promote the infrastructure. Thanks to the Prime Minister of India, who put this Ayushman Sehat scheme and made it functional and universal in Jammu Kashmir especially. But the thing is, it must be promoted. It must be encouraged. The health insurance of the others who don't come into this policy, of the rural population, of the farmers, of the laborers, of the industrial workers, need to be insured so that they get the equal treatment. See, this poor man was never thinking of to get the quality treatment in a hospital which is NABH accredited or which has the state-of-art infrastructure. Because of the Ayushman Bharat scheme, the people did avail it. Otherwise, most of the villagers, most of the laborers, most of the innocent people, because of the non-awareness, non-education about the health, they have to spend from the out of pocket. and this pushes our population towards the poverty. That's unfortunate. If our rural population is our growth engine, we should promote the MSMEs like healthcare service sector in these areas. We should encourage those who have left the country, like we people, to come back. See why we are getting the brain drain. Let me talk about this. Because the merit is not given the preference in our country. Now is the time. Things are changing. We should get those people back. The nationalism, patriotism is checkered there only. They can enjoy them there. Their children can be at better places, but they should think who paid for their education. How did they reach to the US? How did they reach to the UK? How did they reach the Gulf countries? Leaving the getting the back people from green pastures, see the rural need to be encouraged. The people who have graduated from the rural, the doctors, the engineers, and they don't want to serve back in their countries, there are policies to increase the bond, to make a bond with them and give them the job, then only to give the incentives, to train the healthcare workers. We should adopt the models of US and Canada, where the private partners and private players play the part. I feel that would be a great initiative that will make the difference. India has to become a third big economy in 2030. So for this, we need to promote the peripheral healthcare. We need to promote the schemes like NHM, NRHM, Ayushman Bharat, ABHM, which is focusing on the health structure, immunization for the children, health awareness and programs. You will see me at my individual level doing these things in the different areas and going to the far-flung areas, the tough terrains where nobody can reach, giving them the education. So our appeal this time is, our request this time is to the policymakers to focus on the peripheral health care, to focus on the well-being of our farmers. Our 63% of the population, they are consumers also of whatever we produce. They contribute to the GDP. So we need to think of them. And again, the Ayushman Bharat scheme needs to be boosted. The procedures, simple procedures like gallbladder cholecystectomy, hepatectomy, need to be taken to the private sector again. Those who don't interfere with the scheme, they need to be channelized. They need to be dampened. They need to be kept away from this scheme. Because this scheme is a gift from the Prime Minister. We appreciate it. I feel the rural healthcare needs utmost importance from the policymakers, whosoever. We are doing our bit. Our appeal is to the leaders, Honorable Prime Minister, who is doing a lot on the international stage, at the national stage, for the well-being of his people and the country. Men, so we thank for the global conclave to give me the chance to say a few words about the peripheral healthcare and a brief introduction of mine. Thank you very much.